Hello, my name is Megan Quimby, and I'm the director of the Speech and Language program at the MGH FTD Unit. Today, I'm excited to talk about primary progressive aphasia, or PPA for short. I'll be going over the three subtypes of PPA, as well as evaluation techniques we use, and a little bit about its treatment as well. To begin, I'd like to talk a little bit about our speech and language program. It consists of master's and PhD students, clinical fellows, postdocs, and licensed clinicians who are passionate about working with patients with primary progressive aphasia, Alzheimer's disease, and other FTD-related disorders. To begin, I'll tell you what is primary progressive aphasia, or PPA. PPA is a language disorder or an aphasia that gets worse over time, so it's progressive, and the most prominent problem the person experiences is the aphasia or the language disorder. Individuals with other diagnoses, such as Alzheimer's disease or behavioral variant FTD, may have difficulty with communication, but it's not the most prominent feature that they have. People with primary progressive aphasia, especially in the first 2 years of diagnosis, they have the most prominent difficulty that they experience is with language. The three subtypes of PPA that I'll be discussing today are Nonfluent or Agrammatic subtype, the Semantic subtype, and Logopenic. As I discuss these three subtypes of PPA, I'll provide audio samples of patients describing this picnic scene, so keep this picture in mind as I go over the three variants of PPA. The first variant that I'll be discussing is the Nonfluent or Agrammatic. The main impairments that patients with this diagnosis have is something called agrammatism. So they have difficulty producing or comprehending complex grammar or sentences with complex grammar. So they may use short phrases or short sentences to communicate rather than using longer sentences. Another feature they may experience is effortful or halting speech. That's because they oftentimes have difficulty with articulation or pronunciation of specific words. There's something called apraxia of speech or dysarthria, and these are different diagnoses and ways of describing the difficulties they have with pronunciation. However, they do not have difficulty with understanding the meaning of words, which patients with PPA of different subtypes may have. So this is an audio sample of a Nonfluent or Agrammatic subtype PPA patient describing that picnic scene I showed you earlier.
Bull flying a kite, boy flying a kite, and garage, car garage, parked in the garage.
So as you may have heard, this patient had difficulty pronouncing specific words, as well as used short phrases rather than longer sentences with complex grammar. This video is a patient with a diagnosis of Nonfluent PPA talking with a clinician.
Waiting my garden yesterday. Was waiting my garden.
Waiting? Can you write it down for me?
Weeding her garden.
Oh,
yes.
weeding your garden. I'm sorry.
Allergic AC.
You're brave keeping the garden when
Yes,
you have
yes,
allergies
yeah.
like that. Wow, that's amazing.
So the
AC makes me congested.
can you say the full word for AC?
Air condition.
Okay,
Air condition.
good.
So as you may have heard, again, the patient had difficulty pronouncing words as well as used short sentences rather than longer ones. The next subtype of PPA I'll be discussing is the Semantic variant of PPA. Unlike the Nonfluent subtype, their speech is often fluent and grammatical. However, they have difficulty with word finding, or something we call anomia. So they may have a specific word in mind or want to describe something, but they just can't get the word out. And that's because they have a lot of difficulty coming up with the right word that they want to use, these content words, these specific content words that they want to use. They also have difficulty with something called single word comprehension, which is understanding the meaning of words. So for instance, if a communication partner said, oh, can you grab some strawberries when you're at the market, the patient may say, oh, what are strawberries? Because they're not really understanding the meaning of some words. This is especially true with low frequency words, but as the disease progresses, they may have more and more difficulty understanding the meaning of words. So this is a sample of a semantic PPA patient describing the picnic scene.
So they're sitting right there. She's playing something with it for maybe some water or something. He's reading an item.
So as you may have heard, a lot of difficulty with word finding. So it has an empty quality of speech to it. So instead of using specific content words, the patient uses a lot of words like things or stuff or over there, because they can not come up with the specific words that they want to communicate to describe that picture. In this video, it's a semantic PPA patient doing a single word comprehension task. The clinician is asking the patient to point to a picture on the page of 10 items within the same category. So the clinician will ask the patient to point to a specific picture, and really the point of this task is to understand if the patient understands the meaning of words.
I don't know what flyers are. Is this a flyer? Yeah, what kind of animal we're going to look at now?
Squirrel.
Squirrel. Okay, it's official, I don't know.
Try guessing.
Oh, guess. This is a squirrel.
She
I don't
pointed to
know.
the cat.
A camel.
Camel. I want to say this is a camel, but I don't know either.
She pointed to the giraffe.
Peacock.
I don't know what a peacock is.
Try guessing.
I'll guess this one.
She pointed to the eagle. So as you can see, she was having a lot of difficulty understanding the meaning of words, specifically living items. So people with semantic PPA have a lot of difficulty understanding, especially things like animals or fruits, things that are living, more so than non-living objects. The last subtype in PPA is the logopenic subtype. And they have, I would call, a variable fluency to their speech because they have difficulty with word finding like the semantic variant, but not as much difficulty with word finding. So as they speak, they may pause to find the correct word. And they oftentimes have grammatical speech, unlike the non-fluent subtype. They have a lot of difficulty repeating sentences and phrases, and that's because they have an impairment in something we call auditory verbal working memory. So difficulty keeping information in their head long enough to repeat the information back to the clinician. And they do not have difficulty understanding the meaning of words most times. So this is a sample of a logopenic patient describing the picnic scene.
A woman and a wife are sitting in having a pickup. What do you do with it? You have things there, and the kids are all playing out there, and they live over there. And it's a kid picnic over here. They may also be the people who own the boat there, too.
So as you may have heard, this patient had difficulty with word finding, some difficulty coming up with the specific content words that he wanted, as well as something we call phonemic paraphasias, so difficulty pronouncing the first sound of a word correctly, so maybe saying plate for plate. And this subtype of PPA, sometimes the pathology in the brain that's causing these characteristics is Alzheimer's disease. So sometimes the logopenic PPA subtype, we call an atypical form of Alzheimer's disease. So in this video, a patient with logopenic PPA is repeating phrases and sentences back to the clinician to get at if she has an impairment in auditory verbal working memory.
62 and a half.
62 and a half.
Perfect. The pastry cook was satisfied.
Can you give me that?
The pastry cook was satisfied.
Oh. What was the? No, I'm not getting it. I'm sorry. Could you do it?
So as you saw in that video, the patient was having difficulty repeating back longer sentences to the clinician. So she was able to repeat back phrases, but as soon as the amount of information became longer, she was having difficulty repeating back those sentences, which is a characteristic of that subtype. Now that I have gone over the 3 different subtypes of PPA, I'll talk a little bit about how we evaluate PPA patients. So as many of you know, when you come into the clinic, it often takes hours to really understand what's going on and provide a diagnosis. And we do this with a comprehensive speech and language evaluation, neuropsychological testing, MRIs, PET scans, a variety of tasks to really understand what's going on, because these are rare disorders and it really takes an interdisciplinary team to know what's going on. So in our lab, we're happy to provide something called the Progressive Aphasia Severity Scale, developed by Daisy Hochberg and Dr. Dickerson. And what this is a scale between 0 and 3, 0 being normal, no impairment, or 3 being severe impairment or non-functional, in a variety of speech and language areas. So they're listed here, for instance, articulation, word retrieval, reading, writing. And so we use clinical judgment as well as patient and care partner interviews and testing to understand what areas of speech and language are impaired and which ones are not. And this allows us to better understand and monitor how the disease progresses. And so that allows us to know, what treatments work best. And once we have these treatments, are they working or are they not working? Because the Progressive Aphasia Severity Scale allows us to know what is the typical progression, what happens when. And all of you coming in and providing details about, how did the diagnosis begin? What were the initial symptoms? What is affecting your loved one now in daily life really helps us understand these diseases better. And the Progressive Aphasia Severity Scale is being used all around the world, which is really important because it provides a structured way of assessing and monitoring patients over time. And it gives us more information and more data to be able to provide treatment and to better understand the disease and hopefully find a cure in the future. So now that I've gone over a little bit about evaluation, I'd like to talk a little bit about therapy, speech and language therapy for primary progressive aphasia patients. So the goal is enhancing functional communication. And what I mean by this is really using the strengths of the patient to get their message across in the best way possible. So it doesn't have to be a perfect way of communicating. It just needs to be the best way for them to use their strengths to get their message across. So for instance, if someone has difficulty with articulation, maybe the best way is to not use speech to get their message across, but maybe use writing if that's their strength. For speech and language therapy, I recommend having the therapy with an experienced clinician. These are rare disorders, so it's really important that the speech language pathologist has experience working with individuals with neurodegenerative diseases, specifically because the treatment for these diagnoses are a lot different, for instance, than if someone has language disorder or an aphasia from a stroke. I typically recommend 8 to 10 sessions to really understand the best communication strategies and to have check-in sessions if characteristics change or the impairments change, to check in with the clinician to better able to communicate more effectively using compensatory strategies. And a really important part of the therapy is having a family member or a care partner in with the patient during the speech and language therapy sessions, because the patient is figuring out different ways to communicate more effectively, but the care partners and the communication partners are also developing new ways of communicating as well. So there are many different communication strategies that are used in speech language therapy. I'll go over some of them. For instance, assistive technology is really important for patients with a non-fluent subtype of PPA who may have difficulty with articulation. They can have the device speak for them, or they can write down sentences instead of speaking them. Even a physical communication book is often very helpful for all subtypes of PPA. For instance, the clinician can work with the care partner and the patient to create a personalized notebook with all their favorite restaurants, maybe their doctors, family members, places they like to go, hobbies. So that way, instead of using language and speech to communicate, they can point to a picture in the communication notebook to provide information about their needs and feelings and things like that. Drawing and gestures and writing can be very helpful in addition to speech. Structured yes/no questions can also be extremely helpful. So for instance, instead of using open-ended questions like what would you like for dinner, a care partner could say, do you want rice for dinner, yes or no, or do you want rice or fish? So maybe two choices instead of an open-ended question. Something called PAL or PAL is a word-finding compensatory strategy. Sometimes PPA patients have difficulty finding that exact word they want, and they may get frustrated or anxious. So instead, we try to get them in the habit of describing the words instead. So thinking about the purpose or the appearance or the location of the word might be helpful. So if they're trying to think of the word apple, they may say it's red, it's round, it's found in a market, things like that. Environmental modification strategies are extremely important. Everyone's rushed nowadays and there's a lot going on, but face-to-face interaction is really important. So, try to eliminate distractions such as, loud noises or being in separate rooms while you're trying to communicate, and try to reduce internal distractions as well, things like anxiety and worrying and frustration. So when both people are relaxed and they're not rushed and they have time to communicate with each other, really sitting down face to face and trying to use these communication strategies that they found in speech language therapy can be very helpful. Something called impairment-focused treatment can be helpful for very mild or mild patients with PPA. Instead of focusing on compensatory strategies, they focus on the impairment they're having. So semantic feature analysis, for example, is a impairment-focused treatment strategy for word-finding difficulty. So similar to PAL, you really think about semantic features of a word and then use the word in sentences and write it down and repeat it. And the goal is to really relearn these words that they're having difficulty remembering. And for this, it's really important that they use personalized words, because you can't relearn a lot of different words. So maybe specific words that person uses often that they're having trouble remembering. Script training is an impairment-focused treatment strategy for non-fluent or agrammatic patients who have difficulty articulating. So script training is basically the clinician and the patient and the care partner come up with scripts together that they use often, in daily life. For instance, if a patient is a hairdresser and they have a similar conversation at the beginning of work with a client, and they use that often, but they're having difficulty speaking that script, then the clinician and the patient and the care partner can come up with a script and then really repeatedly practice pronouncing the words in the script over and over again. And research has shown that has helped with pronunciation of that specific script over time. But again, these impairment-focused treatment strategies are really for mild or very mild PPA patients. we really recommend compensatory strategies most often for individuals diagnosed with PPA. I'd also like to talk about support for PPAs. Support groups are extremely important. Again, these are very rare disorders. So support groups for patients as well as caregivers are a way to connect with each other. In our lab, we have had PPA and caregiver support groups. So it really allows patients to understand that other people are going through the same thing as well as caregivers, so they don't feel so isolated. Music groups can be very helpful. We've had music therapy in our support groups, and it was really amazing to see the connection that is allowed between a care partner and their loved one through music. Community events are really important. Katie Brandt really allows our lab to have many community events. We're having webinars every week. Last week, the speech and language program provided a webinar of communication strategies for PPA. So please keep connected with us so we can eliminate isolation while going through these diagnoses and support each other. I'd like to give a special thanks to the speech and language program. Not only do I love working with all of these people, but they're really passionate about helping patients and families going through these difficult diagnoses. So I can't thank them enough.